Are aching joints preventing you or someone you care about from activities you enjoy, or maybe they just impact your daily routine? Dr. Ulric Bigby with Cone Health Orthocare Alamance is here to talk about how to help our aching joints. So let's get started with that. All right, besides a fall or traumatic injury, because that's a whole nother thing, what are some of the most common causes for an aching joint?
So by far the most common cause of aching joints is arthritis, also called degenerative joint disease. And arthritis is just a fancy word for the cartilage on the end of the bones, that smooth tissue that allows your bones to glide smoothly, that wears out. So when that wears out, instead of your joints gliding smoothly, your bones rub on each other, which can, of course, cause a lot of pain.
Okay, and there's a lot of people going, oh, you're telling me I have arthritis. I didn't think I was old enough to have arthritis.
Mm. Yeah, well, we see people of all ages with arthritis. The youngest person I've done a hip replacement on is an 18-year-old who had a congenital issue and had, developed arthritis throughout her teens. And, she showed up in my office with bone-on-bone arthritis. So really, all ages, you can have arthritis.
Okay, well, when people hurt, when we have those aches and pains, the natural reaction is, let me rest, let me be less
Right,
mobile. Does
right,
that help
right.
the situation or does that make it worse?
So, that depends. Rest for a short amount of time can help the situation. And of course, this kind of depends on what's going on. So if it's a traumatic injury, rest for a couple of days can be very helpful. But if you have an injury or if you have arthritis and you rest for too long, what can happen is your joints get very stiff. And once your joints get stiff, it's hard to walk, it's hard to, get your muscle back. So it can be, resting for too long can be damaging to the joint.
All right, so let's talk about like some of the steps maybe that people can take at home to help with their aching joints.
Sure,
Nobody wants
sure.
to go to the doctor's office first, so they want to see if they can take care of it
Right.
at home.
Right. So, the first thing, of course, rest and ice. Always rest and ice. Resting and icing decreases inflammation, which can help a lot with the pain. Elevation can also help with swelling, which in turn also helps with the pain. Number two, over-the-counter pain medications. So Tylenol, naproxen, which is also known as Aleve, ibuprofen. All of those medicines can be very helpful, but of course, check with your physician first to make sure you're allowed to take those medications. And number three, some light movement of the joint. Nothing that hurts, but just light movement that will get your joint moving again, so it doesn't get stiff. All things that can be done at home before seeing your doctor.
Yeah, and there's a difference between it hurting, right, and it being stiff. And sometimes you got to move a little bit to figure out whether it's actually painful or whether it's like, it just is not happy with me right now.
Sure, exactly. Sometimes, you should definitely move it a little bit. Um, Regardless of if you have an injury or if it's some long-term issue like you've been diagnosed with arthritis, you should definitely get your joints moving. When you're at home after they hurt.
Okay, are there some things that now you talked about what we should do? What should we not do?
So I think the biggest things we shouldn't do is push through the pain. So that's what
Mm.
you absolutely should not do. Pushing through the pain, doing a lot of activity, going back to sports, going back to running, even though you're in a lot of pain, that can cause extra damage, can really hinder your ability to recover from whatever it is that's going on.
Okay, so if we're having like pain, like nuisance pain, that's like, like a 2 or a 3, that's okay to move the joint. But when it gets to like a 7,
Exactly. If it gets to a 7 or an 8, you should not be trying to push through that type
okay,
of pain. You should be
okay.
probably going in to see your physician.
I needed some parameters there because everybody's got a different definition of
Right.
what hurts and what
That's
doesn't for
very
sure.
true.
All right, so how long should someone try home remedies before they actually do go see the doctor?
So that depends. If you were playing a sport outside, or let's say you're playing pickleball, which is very popular now, and you hurt your knee and you just have a little ache, I think resting, icing, taking over-the-counter meds for a couple weeks is fine. Um, and it also, if you've been diagnosed with arthritis and have some long-term issue, I think a couple of weeks is fine. But if you have an injury where you can't walk, if you have even if it's you've been diagnosed with arthritis but you can't put any weight on the knee, if you fell, and or if you have some type of deformity, those are things you should see your doctor for right away.
Okay, all right. We're going to continue this conversation because there's plenty of us out there with aching joints. We'll be back in just a few minutes.
All right.